Welcome to the pharmaphorum podcast. This is web editor Nicole Raleigh, and today I'll be speaking with James Davis, a healthcare expert at PA Consulting, for a conversation on the digital foundations needed to unlock a prevention-first NHS. Welcome, James.
Hi, Nicole. Thank you for inviting me.
Now, James is also the author of a new national survey of NHS leaders, the findings of which we will be discussing today. But to begin with, James, I was wondering if you could briefly introduce yourself for our listeners and provide the background, the journey that led you to doing what you do today.
Certainly. So, as you said in your introduction, I'm James Davis. I'm a digital healthcare expert at PA Consulting. I've worked at PA for 20 years, delivering big digital and organisational transformation programmes. And I've done that across most sectors during my time at PA. But then at the start of the pandemic, I joined the NHS to help set up the COVID deployment programme. And given my background, I quite quickly moved on to the technology work stream, where working with others, we put in place the technology platform that helped to underpin the delivery of COVID and flu vaccinations. And as you can imagine, that was a really challenging experience, but one that was really rewarding. And seeing the impact that we could have on people's daily lives was something that made me want to stay in the healthcare sector. And so post-pandemic, I've continued to work with NHS England to roll out that technology platform to other NHS-run vaccinations, but then more recently start to focus on the government's shift to prevention, and in particular looking at the technology that will help to support that shift.
Thank you, James. So, as you say, this importance on the beneficial impact on daily lives, on patient lives, is what matters. So moving to that preventative pillar that has become a governmental discussion point, shall we say, the report's findings, that is to say, listeners, the PA Consulting report's findings, reveal a striking gap. Public demand for prevention is surging, with 33.6 million people now using the NHS App, more than double UK Netflix subscribers. However, NHS leaders say the digital infrastructure required to deliver prevention at scale isn't in place. So, James, I was wondering if you could tell us more. Firstly, what do we actually mean by digitally powered prevention?
Well, that's a good question, Nicole, because I do think that sounds like one of those consultancy phrases that we all love to hate, but put very simply, digitally powered prevention refers to the set of digital products and services that the NHS and others provide that help to promote healthy lifestyles and enable early intervention to help people to manage their health more effectively. And when the NHS talks about prevention, it normally talks about three types of prevention. So you have primary prevention, which is about preventing disease from developing in the first place. Secondary prevention, which is about preventing existing conditions from deteriorating. And tertiary prevention, which is about managing long-term conditions over time. The focus for our report is very much primary and secondary prevention, and that covers everything from at-home diagnostics through to wearables and lifestyle apps, to how we aggregate all of the sort of rich health information that we have about individuals into a single place so that we can use things like AI-based risk analytics to spot people's health risks, communicate with them and help them understand what action they can take to manage those health risks more effectively. I think a good example are digital health checks, which is something that the NHS started to roll out in a limited way last year. So in England, everyone over the age of 40 is entitled to a free cardiovascular health check, but uptake of that service is currently low, stands at around 40%. Lots of reasons for that, but one of the reasons is that that service is a face-to-face service at the moment and normally requires people to make an appointment with their GP. We all lead very busy lives, and so that can be a real barrier for people to access that service. The digital health check enables people to complete a questionnaire online or via the NHS app. They can order a home blood test kit to test for cholesterol. And then the results of that information are aggregated to provide people with a risk score. And that's presented in a really simple to understand way by providing people with their heart health age and comparing that to their actual age. And on the basis of those results, people can be prompted to take action, which could include going to see their GP. The only thing you can't do at the moment is measure your blood pressure remotely unless you happen to have a home blood pressure monitor. but even that will change soon. So there is an organisation called Lifelight that now has medical device approval for an app that uses your phone camera to monitor the tiny changes in skin tone as your blood passes through it, and can use that to deliver an accurate blood pressure reading. So a really good example of how technology is supporting the agenda.
Absolutely, and a very good example of just where technology is today. So are these, would you say these are the initiatives perhaps with the biggest near-term impact, James?
Certainly one of them, but I think if we're talking about those areas with the biggest impact, it's really impossible to overlook cancer screening and early diagnosis. That was certainly true of our survey respondents. So a bit of background maybe to the report, first of all. When we produced the report, we wanted to focus on what it would take to deliver some of the commitments that were set out within the government's 10-year plan. There's been an avalanche of thought and opinion pieces about that 10-year plan. So rather than contribute to that, we wanted to think about what it would take to deliver that 10-year. We wanted that to be based on our experience of working nationally with the NHS and locally with trusts and integrated care systems, but we also wanted it to be or to reflect the voice of people who are going to be operationally responsible for delivering those changes. And so we surveyed 66 leaders from across national and local care organisations. And so going back to your question around these initiatives that will have the biggest impact, cancer screening and early diagnosis was one of those that was ranked in the top 5 by 71% of the respondents that we spoke to. And of course, technology's got a really big role to play in this area. So we're seeing increasingly the use of artificial intelligence in breast screening, monitoring, and that's delivering some really good results with studies showing that it can lead to a 30% reduction in clinician time, but also an increase in the numbers of cancers that are spotted without creating any additional false positives. But we're also working with the NHS on some really practical changes as well. So things like rolling out digital first invitations and appointment bookings across those national cancer screening pathways. That was something that we first did during the pandemic with vaccinations. So if you wind back to the start of the pandemic, we used to send letters out to invite everyone for their vaccinations in the very bright blue envelopes that we used at the time to mark them out. By the end of the pandemic, we started to send out digital first invitations, which meant that people would receive an app message via the NHS app, a text message, or an email, with letters being a last resort. So a really, really simple change, but one that has the power to save many millions of pounds in avoided postage, and also has a much better experience for patients as well, because everyone's got a personal story of having missed an appointment because a letter arrived too late or didn't arrive at all. And for me, one of the great things about the 10-year plan, there are some naysayers around the 10-year plan, but one of the great things about it is that it's really helped to galvanise action and excitement within the NHS to deliver more of these kind of technology changes. And we're certainly seeing it as a focus for investment. So cancer screening and early diagnosis is now just one of many areas where we're seeing these kind of technology changes. Perhaps if I reference one more that we're working with the NHS on, there was another key commitment within the 10-year plan called the Health Store. So this set out this idea of an app store of health apps. Now we're working with NHS England to try and bring that to life by providing an nationally approved list of digital therapeutic applications. So these are applications that are available currently. They, in many cases, have medical device approval. There's good evidence of their efficacy and their cost effectiveness. But a person's ability to access that is very much a postcode lottery at the moment. It depends very much on the local buying arrangements that trusts and integrated care systems have in place. And that means that for vendors, they're often struggling to scale that technology as well. And so there's a really good example here of how the NHS can take a lead role within a wider ecosystem of public and private sector providers to remove some of those practical, operational and commercial barriers.
Thank you, James. So I want to go to what you mentioned there about the postcode lottery. So we've been talking about NHS leader worries about the struggle for scaling these innovations, but along with this digital transformation, these advances and the clear potential of technology, there yet remain issues of trust and inequality, sadly. So this risk that you're speaking of, is it a risk, or if we take the sort of other stance of the glass half full, is it an opportunity?
So through the survey that we conducted, the vast majority of respondents, so 4 out of 5, agreed that embracing technology was going to be vital to delivering the prevention agenda and vital to improving outcomes. But as you're saying, Nicole, they rightly identified some risks and worries that they're concerned about. And there were 3 that came top. So firstly, they were worried about increasing the administrative burden on staff. Secondly, as you've said already, they were worried about increasing health inequalities, and in particular, digital health inequalities. And thirdly, they were worried about the implementation of technology at the expense of changes to the underlying care pathways. And for me, that says a couple of things. Firstly, we have to get better at providing a support wrapper around the new technology that we implement. We can't expect to deliver new digital products and services, throw them over to the front line, and the front line understand how to use them and move away from existing ways of working unless we provide that support wrapper and that training and change management. And that's something that historically the NHS has not been great at, but it will be key to unlocking the productivity savings that ministers and the NHS are so focused on. And secondly, all of this only works if that technology is genuinely embedded into care pathways and not seen as an add-on. And that means regularly updating national and local policy guidance to take account of new technology as it comes through. I was talking to a vendor recently who was bemoaning the fact that because their application is seen as a digital therapeutic, there is no way for GPs to be paid for prescribing that to patients in the way that they would be paid to prescribe drugs. And so there's no incentive for GPs to help them roll out that solution, despite the potential patient benefits. So looking at some of those structural barriers and how we can remove those is really, really critical.
Absolutely. So my final question, if we think about today and we think about tomorrow, what does effective support look like? What's that comparison, James? Can you sum it up for our listeners today?
Again, I think there's 2 things that came across clearly from the people that we spoke to. Firstly, all of this only works if the NHS works in partnership with a wider ecosystem of organisations within the public and private sector, and that will include local authorities, voluntary organisations, social care, and those private sector providers as well. Within the digital circles in the NHS, I often hear this sort of unhelpful ideological debate about whether technology should be delivered in-house or outsourced. And as I say, I find that debate quite unhelpful in itself. I've seen really great examples of in-house delivery of technology that really focuses on a user need, addresses that user need, helps to transform a service and receives great feedback. And when that happens, it's got all of the consequential benefits of keeping that data in-house within the NHS and all of the intellectual property in-house. But through this conversation, we've also referenced some examples of really good local innovation from suppliers and private sector organisations. And so the question there is, how can we help those organisations to scale so that it can move beyond local delivery to something that can happen nationally? And there will always be a role for some of the mega technology players to provide some of those platforms that underpin and provide the backbone for NHS systems. So again, the question here is, how can the NHS take on that leadership role across that wider system? And it needs to do that in a way that is more collaborative and less combative than we've seen in recent years. And again, something we're working with NHS England on at the moment is how we can put in place a set of partnership arrangements with industry to look at how we can deliver that change more rapidly across the industry. Then the second area I think that came across strongly, and it'd be remiss if I didn't mention it, was short-term financial planning. So 2/3 of people in our survey rated that as one of their key worries, key concern areas. And it certainly was the one thing that came across in all of the one-to-one interviews that I helped. And there's a reason for that. When you're dealing with an annual funding round, as the NHS has become used to over recent years, most technology takes more than 12 months to implement, and certainly more than 12 months to deliver benefits. And it's really difficult to commit to that if you can't see the funding endpoint. So I think it's been a really positive step forward that at the end of last year, the government announced the move to a 3-year funding cycle. It doesn't resolve the fact that funding is still constrained, and much of this is still going to be delivered through non-core funding, things like the Frontline Productivity Fund that was announced recently. So it's a £1.3 billion fund that will help to drive out innovation across the system. Those things are time limited and constrained, but they provide a really important boost to seed innovation. But again, the question there for the NHS and for private sector suppliers alike now is, how can they demonstrate that the technology that they're going to implement will deliver savings and deliver productivity benefits quickly? That focus on evaluation is going to be one of the key things, I think, that will be a target over the next 12 to 24 months.
Thank you, James, very much for your time today. Lots for our listeners to ruminate over. It's been a pleasure.
Thanks, Nicole.
And that concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaphorum.com/podcasts. The pharmaphorum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for pharmaphorum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at pharmaphorum. That's all for now. Thank you for listening.